Inspiration 4. Hearing well. Treating hearing loss and reducing cognitive decline. Dr. Jill E. Copley, Au.D, CCC-A. Preface. Today, approximately 48 million people in the United States are suffering from hearing loss. Yet nearly 40 million of them go without treatment. This is why I wrote this book. Did you know that hearing problems, even at the mildest stage, can lead to social isolation and increase the risk of dementia? Do you want to remain independent and live an active life as you age? Do you or a loved one have impaired hearing? Do you experience tinnitus, noises ringing in the ear? If you or a loved one has answered yes to any of the above questions, I encourage you to read this book and learn how you can live a better, more active, more engaged, and healthier life as you age. For almost 30 years, I have been helping my patients and their loved ones break free of their hearing loss and live active, engaged lives free of the worry, stress, and medical consequences of untreated hearing loss. Hearing is what connects us to others, to our lives and our loved ones. Hearing is a requirement for every personal and professional relationship we have. It is the building block of communication. I have put together this book to help you understand the consequences of untreated hearing loss and to introduce you to how today's medical options for treating hearing loss can not only help improve hearing, but also improve cognitive function, decrease your risk of developing dementia, depression, and falling, while also increasing your physical activity and helping you live a happier and healthier lifestyle as you actively age. Hearing loss has been listed by the Department of Health and Human Services as the third most common chronic health condition affecting seniors. Third, hearing loss is estimated to affect nearly 50% of adults between the age. Dr. Jill E. Copley, Au.D, CCC-A 9. Of 60 to 70 years old, nearly 67% of adults between 70 to 80 years old, and the numbers only go up from there. As we live longer and science continues to increase life expectancy, we need to be best prepared to deal with this debilitating disorder and understand how it can impact our lives. Our bodies are amazing machines. You may be familiar with the song which describes how the toe bone is connected to the foot bone is connected to the ankle bone is connected to the shin bone. Well, our ears are connected to our brain. By keeping the brain active through better hearing, you can live your best life, stay connected, live without tinnitus and continue making wonderful memories. My journey up to this point has been filled with almost 30 years of experience, from student to clinician in multiple settings. I am now in private practice as a provider, daily patient advocate, and owner. I was lucky to discover what I love to do early in life and, as a result, I have the good fortune to work with patients and their families every day as they embark on the journey of improved hearing and clarity. Another area of interest for me has always been how the brain works. My doctoral research included a paper on how hearing relates to dementia, and much of my independent continuing education is in that area of study. As a doctor of audiology with years of experience in helping people hear better, I have a unique perspective on how the brain works with sound and how hearing relates to overall health, well-being, and cognitive function. I also understand how treating hearing loss early, even before it becomes a problem that you and everybody around you can notice, significantly impacts your overall health and cognitive function and how it may significantly reduce your risk of developing dementia. I know that I am blessed to have the capability of transforming lives and families every single day. Treating hearing loss is not magic. It is the perfect mix of science, experience, and the art of listening to people, which allows myself and my team to use advances in medical treatment of hearing loss, A. 10 Inspiration for hearing well. Technology treatment plan to stimulate the brain, improve cognitive function and mental health, and help adults remain independent. And the best part, it is simple for patients to manage, and it's more affordable than most people think. Dr. Jill E. Copley, Au.D, CCC-A 11. About the author. Dr. Jill Copley is an experienced audiologist whose love of audiology began in college with her science courses. She obtained her BS and MA in Communication Science Disorders, with an emphasis in audiology, from the University of Texas. She received her Doctor of Audiology degree from the University of Florida. She worked for many years in ENT and private practice settings before purchasing Total Hearing Care, in Dallas, Texas, in 2015 after the previous owner retired. She now owns several audiology clinics in the Dallas and Plano, Texas, areas. Jill is a member of the American Academy of Audiology, AAA, the American Speech, Language, and Hearing Association, ASHA, and the Texas Academy of Audiology. She is American Board of Audiology certified and has her Certified Dementia Practitioner certification. Jill and her husband are proud to call Dallas their home. In her free time, she loves to travel with friends and family. Jill is passionate about saving the lives of homeless cats and dogs. She is a member of Best Friends Animal Society, in Utah, the country's largest no-kill sanctuary for homeless pets, including dogs, cats, rabbits, birds, horses, and more. She also supports the Austin Humane Society. She and her husband have a cat and a dog, and they employ humane trap, neuter, vaccinate, and release procedures to give community cats in their neighborhood a better life. She is active in her local HOA. 12 Inspiration for hearing well. Introduction. The top 5 reasons people avoid seeing a hearing care specialist. My name is Dr. Jill Copley, and I'm a private practice audiologist. When people hear what I do for a living, they almost automatically wince or say, "Huh? I've heard that joke a lot. It's okay, I'm used to it." The fact is, the less you know about audiology and treating hearing loss, the more reason you have to be afraid of it. Once upon a time, audiology meant one thing: big, heavy, ugly beige bananas to be worn on your ear to make sounds louder. They were hard to put on, hard to adjust, and frankly, they were pretty terrible at doing anything other than making all sounds louder. This includes speech, background noise, loud ventilation machines, dogs barking, plates clanging, etc. For the majority of patients, wearing an old-fashioned hearing aid meant avoiding certain social situations, restaurants, family gatherings, playing with grandchildren, etc. Many people still cling to the unfounded notion that all hearing aids are created equal and perform the same way they did back in the 90s. I was just getting started back then. I remember those things. The fact of the matter is that audiology and the clinical science of treating hearing loss is more than just hearing aids. How much more? Audiology and the medical treatment of hearing loss is devoted to restoring an individual's clarity, restoring personal independence, improving cognitive function and mental health, and addressing the cognitive aspects of hearing loss that can increase the risk of developing dementia. Dr. Jill E. Copley, Au.D, CCC-A 13. Maintaining proper hearing and cognitive health has a significant impact on an individual's life, including all of his or her family, friends, and community members. Properly stimulating cognitive function and maintaining connections from the ear to the brain goes a long way in keeping a patient mentally competent, helping the patient remain autonomous, and helping keep at bay the mind-robbing diseases associated with cognitive decline, i.e., Alzheimer's. Treating hearing loss is a wonderful investment with lifelong returns, And yet people still fear walking into a hearing healthcare provider's office for one simple reason: fear of the unknown. Hey, it's okay to be worried about the unknown. We all have our reasons for avoiding the doctor. For many, visiting a doctor of audiology is accompanied by many fears and anxieties. And for each patient, the experience is personal. There are reasons that patients typically wait 7 years before being seen by a doctor of audiology and beginning treatment of their hearing loss. This list, Top 5 Reasons People Avoid Seeing a Hearing Care Specialist, has the most common conversations I have had with patients over the years about what took them so long to come into my office. Reason number 1: the patient already knows the diagnosis before he or she ever steps foot in the door. Individuals with hearing loss tend to wait nearly 7 years before raising their hand and admitting they have a problem. Or perhaps it takes a family member nearly 7 years to push his or her loved one through our office door. Either way, 7 seems to be the unlucky number. I say unlucky because chances are very high that by the 7th year of experiencing the symptoms of hearing loss, significant damage has been done to the auditory system, which can lower treatment outcomes. I try to explain to all of my patients that hearing loss is a progressive degenerative disorder with neurologic involvement which undoubtedly requires 14 inspiration for hearing well. Early intervention. In lay terms, that simply means that your hearing will continue to degrade as you age, and the key to maintaining clarity and a higher level of hearing function, i.e., hearing in noisy environments, is to catch it early and treat it early. I have empathy for the new patient who comes to my office to get his or her first hearing evaluation since grade school because I know, as does the patient, what the results will likely be. It is very brave for a patient to knowingly enter a medical office with the understanding that he or she is likely to receive the diagnosis of progressive degenerative age-related hearing loss, especially a disorder that is neither reversible nor has a cure. However, there are restorative treatments available that can help the patient stay connected at home, at work, in their community, and that can help stimulate the brain, improving cognitive function, and even reduce the risk of developing dementia. More on the connections of hearing loss and dementia later in the book. Reason number 2: the patient is not sure of his or her insurance coverage for the procedures and treatments involved with hearing loss. Regardless of when you read this book and which administration is running our country, insurance is a complex world to attempt to muddle through, and when it comes to hearing healthcare coverage, it can be even more murky. But nearly every insurance company I have come across allows for coverage of one diagnostic hearing evaluation per year by an audiologist, and more testing can be covered if medically necessary. i.e., if the patient notices a significant sudden change in hearing. A hearing evaluation is often considered preventative and, in most cases, does not require a referral from your physician. While it is nearly impossible to speak for every patient and every insurance plan, this is intended to help ease the stress of navigating the process of hearing healthcare coverage. In fact, I believe any reputed Dr. Jill E. Copley, Au.D, CCC-A 15. Bull hearing healthcare practice will have a deep understanding of the insurance regulations in its area and will be able to readily answer any questions you may have about your insurance coverage. Our office has in-house insurance specialists to help you find the answers. In my many years of experience in the hearing healthcare field, I have watched firsthand as patient benefits for treatment of hearing loss have evolved. Medical treatment of your hearing loss may have an out-of-pocket cost associated with it, but I have seen insurance cover anywhere from 10% to 100% of the costs. And even if you were in the position of having 0% insurance coverage, treating hearing loss can be affordable, and you will learn throughout this book that treating hearing loss is truly priceless and can hardly be assigned a monetary value. Reason number 3: patients are afraid of being sold something. It's like magic. Once you turn the respectful age of 60, you notice that the content of your mailbox seems to change. Nearly every week, perhaps a few times a week, you are blessed, I'm being sarcastic, to have a full mailbox, both your physical and electronic mailbox, with literature about essential vitamins for seniors, how to choose the right assisted living residence, how to invest your retirement money, join AARP, and which digital technology widget is best for your hearing loss. Yikes. Somewhere along the line, hearing healthcare started down the dangerous road of becoming a retail transaction. I've even seen some so-called hearing devices sold at big box retailers and chain pharmacies. Like I ask my patients, if a colonoscopy was available at one of the big box chains, would you take your loved one there to have it done? No. So why would you treat your hearing loss there? It is certainly easy, free hearing test and all, but the nature of a big box store does not allow for the gold standard of care that everyone deserves. There is so much miss. 16 Inspiration for hearing well. Information out there. I don't blame the patient for sometimes entering the office thinking she is going to be sold something. My best advice is to steer clear of anybody trying to sell you something. Be wary anytime the hearing test is free. If we go back to reason number 1 above, the patient is likely already nervous because he or she knows the medical diagnosis before ever even stepping foot in the office. Combine that with the fear of being sold something, and that makes for a pretty nervous patient with his or her guard up. Unfortunately, much of modern medicine is turning into a commercial advertisement seen on TV that marginalizes the process of treating a medical disorder, and hearing healthcare is not immune to this. In my ICE, our belief is in the medical evaluation and treatment of hearing loss. I believe strongly that the proper medical treatment of hearing loss is best left to the clinicians specially trained to understand, diagnose, and treat your hearing loss. Reason number 4: the cost. Actual cost. We all know somebody, perhaps a family member or a friend, who has spent a significant amount of money on a hearing aid gizmo only to use it as a paperweight or to leave it in his or her sock drawer. And the reason is because the glorified overpriced amplifier that he or she purchased was never truly designed to improve hearing or clarity. It was designed to just make sounds louder. This truly angers me, and while I do believe that the patient plays a significant role in his or her healthcare decisions and follow-up care, the healthcare provider also must have a significant responsibility to the patient even after the patient has left the office. I have heard many horror stories about patients spending upwards of $10,000 on a pair of hearing aids. Yikes. More often than not, this Dr. Jill E. Copley, Au.D, CCC-A 17. Very high retail transaction very likely took place in one of the chain hearing aid sales shops with free hearing tests, i.e., the Miracle Hearing and Bellstone shops. FYI, the real names of these retail establishments have been altered in an attempt to reduce my chances of being sued. And, sadly, All the patients got in return for their money was a hearing aid amplifier capable of making things louder. When a practice and the providers are committed to the medical treatment of hearing loss, you can trust that you are in good hands. I believe that a hearing specialist must meet the strict standards required of total hearing care and follow the medical model of treating hearing loss. I have always believed that the patient needs options to help him or her invest in proper hearing health care. A reputable audiology practice understands that for some people, the upfront investment in hearing healthcare can be prohibitive. Patients must be provided with options. Total Hearing Care will offer reputable creditors banks to help establish a payment plan, some with 0% interest for up to 12 months, or even a longer-term payment plan with fixed interest rates. Recently, we discovered an affordable plan that will be offered at my clinic. This provides individuals with the opportunity to pay a one-time down payment and a small monthly fee thereafter, with the advantage of full warranty, loss, damage, and repair coverage, complete access to supplies, service appointments while under warranty, and no-cost automatic upgrades. Hidden cost. What about the cost of not treating hearing loss? While research has yet to make the definitive finding that hearing loss can cause dementia, causality is often difficult in clinical science. The evidence that the relationship exists is overwhelming. Even more important is the mounting evidence that treating hearing loss may significantly reduce the risk of developing dementia. 18 Inspiration for hearing well. Every day, 10,000 people turn 65. This trend is expected to continue for at least the next 15 years. And it is almost a guarantee that over the next 15 years, science will continue to reduce the mortality rate and increase the average life expectancy. As a result, our healthcare system will be pushed to its capacity to deal with diseases such as cancer, diabetes, cardiovascular disease, etc. Perhaps the most prevalent, most costly, and most disabling of all diseases we will see sharply rise over the ensuing decades is dementia, the mind-robbing mental disease that interrupts and interferes with every aspect of life. Dementia is not a normal part of aging. Every 3 to 4 seconds, another patient is diagnosed with dementia. Rates of dementia are estimated to triple in the next 30 years. Unlike the other diseases listed above, a physical body with dementia is estimated to outlive the individual's mental capabilities by 10 or more years. It is estimated that the average cost per family to manage the medical treatment and care of a loved one with dementia can exceed $57,000 per year. There is no cure for this catastrophic disease, but there are treatments available, including several ways to decrease your risk of developing dementia. In fact, a study published in the Lancet Journal indicated the treatment of hearing loss as the single most effective means of preventing dementia. Reason number 5: everybody hates hearing aids. Let's be honest. Everybody hates hearing aids. In fact, when you make a reference to old-fashioned volume-enhancing hearing aids, I think you could go so far as to say, some hearing aids are horrible. There you have it, I said it. I've been working with hearing-impaired patients for close to 30 years, and although my patients love improved hearing, they hate their hearing aids. I don't see a reason to tiptoe around this. Dr. Jill E. Copley, Au.D, CCC-A 19. Subject or ignore the fact that patients generally do not like using hearing aids. Nobody wants a medical disorder that requires physically tethering a device to his or her body to treat the medical condition. They don't like their glasses either, but they do like to be able to see, although I do know some people who wear non-prescription glasses because they feel that they look cool. Glasses are now commonplace for people of all ages. I started wearing glasses at the age of 13 and trust me, I did not look cool. But I did like being able to see the leaves on trees. Who knew? For some people, hearing aids carry the stigma of meaning I'm old and am ready to die. And nearly every day I see a patient try to tell him or herself not to invest in hearing healthcare treatment because I won't be around much longer anyway. My response is always the same, to ask them about the quality of life they want to experience and if they want to remain connected to their loved ones and the world around them. No matter if they live for a few more years, or even 30 more years, which is not unreasonable to expect from my 58-year-old patients, isn't it worth wanting to hear and understand everything and everyone else in your life? I also point out to patients that they will appear to look much older if they continue to say what, or her, all the time, or, perhaps even worse, start to isolate themselves from life and the conversations around them. I get it, and I respect that patients don't want to use a hearing aid, whatever the reason may be. Any reputable hearing healthcare provider will realize this and understand the difference between traditional hearing aids and a technology treatment plan. Features in the technology treatment plan are specifically designed to treat the medical condition of hearing loss, improve cognitive function, and improve overall quality of life. 20 Inspiration for hearing well. Part 1. Dr. Jill E. Copley, Au.D, CCC-A 21. 22 Inspiration for hearing well. Question number 1. Why is hearing so important? Communication is truly the basic building block of every relationship we have at work, at home with our loved ones, with our children, etc. Communication is a vital part of establishing and maintaining relationships. As I started seeing more and more patients with dementia and how the use of good hearing systems helped them, I wanted to learn more about how hearing loss and cognitive decline were related. That knowledge has allowed me to advance my patients' care to the highest level and to understand new standards for testing and treatment protocols used in clinics across the country. Dr. Jill E. Copley, Au.D, CCC-A 23. Question number 2. What are some of the early signs of hearing loss, and when should I see a specialist? Hearing loss is typically a slow, gradual onset disorder that silently, pardon the pun, affects the individual. The most common symptoms experienced by most, perhaps not all, patients are difficulty hearing in background noise, tinnitus, and thinking most people mumble or speak softly. Most people who experience the initial symptoms of hearing loss do not even realize it is happening. It is far easier to blame the acoustics of the room, the volume of the background noise, or the person speaking, i.e., they mumble, than it is to accept that it's your hearing that is lacking. It is also difficult for many patients to rationalize the need for medical treatment of hearing loss because in some ideal listening situations, i.e., sitting at a table one-on-one in a perfectly quiet environment, hearing may not be much of a challenge. But the truth is, a mild hearing loss is a major problem. The first symptom of hearing loss for most patients is difficulty hearing in complex listening environments. If you have this issue, take the time to reflect truly and deeply on your communication breakdown. I believe you will begin to recognize some of the initial symptoms of hearing loss. Are you having any difficulty when there are a few people at the kitchen table? Or when the kids come over? Or when communicating with your grandchildren? Or when you are at a social gathering, i.e., sharing a meal with friends and you can't seem to follow the conversation, yet all the other people seem to be enjoying themselves and following the conversation? It is in these types of scenarios when hearing loss can really start to rear its ugly head and you realize that you are no longer an active part of the conversation. The result is a slow retraction from contributing to the conversation because you may feel embarrassed, and 24 Inspiration for hearing well. Thus you continue to further isolate yourself and find yourself not truly engaging in conversations and relationships. And this is how even a mild hearing loss can really begin to impact your quality of life and relationships with others. In addition to the importance of maintaining an active, engaged life with family and friends, early treatment of mild hearing loss is important for maintaining proper brain health. Simply put, hearing care is health care. Your hearing drives your conception of everything and everybody around you. Thus, hearing is essentially driving cognition at all times. It's driving memory. It's driving your image of the environment around you. You don't turn hearing on or off. You can't close your ears like you can close your eyes. There really isn't a sense or portion of your brain that isn't connected to your auditory system. And I believe this speaks to how important hearing is to live and to thrive. We are bombarded with sound all the time, and the brain is constantly, in real time, making decisions as to whether or not certain sounds are important, trying to figure out how to categorize the sound and if it is important to store away and remember it for reference at a later date. A mild hearing loss can take away significant portions of the auditory world around you and is likely the reason behind why patients with untreated mild hearing loss are 3 times more likely of experiencing a devastating fall than those without hearing loss. The lack of cognitive stimulation that accompanies even a mild hearing loss is also associated with cognitive decline and dementia. Reports from Johns Hopkins Medical Center, and others, indicate that a mild hearing loss can increase the risk of developing dementia by 200%, up to a 500% increase for those with a severe hearing loss. Like every major medical condition, the key to successful management of the disorder is early intervention. Catch it early and treat it early. Dr. Jill E. Copley, Au.D, CCC-A 25. Question number 3. Why, and how, should I choose a specialist for my hearing loss treatment? I get this question so often that I developed a top 10 list. This list can help a patient understand why they need to choose a specialist and how to choose the right specialist to trust with the treatment of their hearing loss. The top 10 things you must know before choosing your hearing healthcare provider. Is he or she a specialist? Hearing healthcare consists of both audiologists and hearing instrument specialists, both working towards the same goal to help more people struggling with hearing loss. Audiologists are clinically trained hearing healthcare specialists with doctoral degrees that require several extra years of training in order to provide diagnostic evaluations, perform wax removal and complete the most comprehensive treatment plans aimed at restoring hearing clarity or treating tinnitus. They are TYP. Ideally located in medical-type offices or a private practice and are able to bill health insurance for diagnostic exams. Hearing instrument specialists are trained to give thorough, non-diagnostic hearing tests and dispense hearing aids. They are typically unable to bill insurance, and often work in private practice or retail-type stores. Both are hearing healthcare providers that perform complete auditory testing, counseling, and rehabilitation, which is likely to include the use of a technology treatment plan that provides proper stimulation to the auditory system. This is a fancy way to describe how we normalize the way our brains process the incoming sounds in order to achieve maximum clarity, especially in background noise. 26 Inspiration for hearing well. Another sign of a great specialist is he or she can tell you about a before and after scenario of a similar case that he or she has previously helped. We know all ears are different, but with the 100,000 plus ears Total Hearing Care have restored clarity to, we can tell you about a similar case to your specific hearing situation. Does the hearing healthcare provider have a medical office or a sales office? If you find a hearing care provider with the best credentials and an office that is inviting and in a medical or private practice setting, you have found a specialist who understands the importance of hearing healthcare and will be around for years to come to help you and your family best understand and address your hearing needs. Total Hearing Care has hearing healthcare clinicians of the highest caliber who insist on the best practice, often setting the standards for best practices for their patients and loved ones. Does the specialist think brain first? Everybody thinks we hear with our ears, and while that is partially correct, the process of hearing actually happens at the level of the brain. Today's hearing loss treatments are far more than a simple amplifying device behind your ear. The neuroscience behind modern treatments is focused on the brain, cognition, and the comorbidities of untreated hearing loss. Comorbidity is defined as a disorder that co-occurs is correlated to hearing loss. If your clinician thinks hearing first and not brain first in his or her treatment plan, you are missing out on many long-term lifestyle benefits. Our technology treatment plan is aimed at restoring lost clarity, providing noise-cancelling filters for noisy background situations, and soft speech enhancers that emphasize the speech of those soft speakers in your life. When searching for your hearing healthcare provider, make sure you Dr. Jill E. Copley, Au.D, CCC-A 27. Ind specialist that understands the significant negative impacts of untreated hearing loss on your brain. Do they include a demonstration after diagnostics are completed? Most audiologists offer demonstrations of technology for new patients so that you and your family can get expert advice about treatment needs, options, and timing before making this important investment. During your first evaluation and consultation, be sure your questions are being answered, your concerns are being addressed, and you are being educated about all your treatment options. The clinician should include a comprehensive written report during or after the evaluation at no charge. Does the provider's office offer an evaluation period with a comprehensive treatment plan? No matter which hearing healthcare provider you choose, ultimately, you are not making a small investment in both time and finances. Most states allow for an adaptation period where you can return treatment technology, subject to a fee for time spent with the provider. That being said, it is important to know that your clinician is going to stand behind his or her medical treatment plan. Be sure your provider offers a plan that covers cleaning services, of ICE visits, repairs, and prescriptive programming. A typical plan is 1 year, but because we follow a gold standard of hearing care, we provide 3 years of coverage in our treatment plan, including loss and damage coverage for our patients. Rest assured, your hearing healthcare is our priority. Thus, I stand by everything I've recommended in this publication. 28 Inspiration for hearing well. Is he or she using the latest technology and treatment options available? Audiology today differs a great deal from years past. Computer-designed technology treatment plan devices and wireless technologies dramatically increase the precision with which we restore clarity and boost hearing ability. Scientific verification of device settings, while in your ear, referred to as real ear measurements, maximize the Scion of technology treatment benefits. As an added incentive, today's technology treatment are discreet and virtually undetectable to the user and others. In fact, a new category of technology treatment, known for being invisible, can offer the most discreet, cosmetically pleasing option placed deep in your ear canal to make the entire treatment a well-kept secret. What are the charges for treatment supplies? Each hearing care office has its own fee schedules, and specialists often charge differently for procedures. All specialists should offer you a contract which clearly spells out the investment for you or your loved one's treatment before it begins. Are there charges for follow-up and emergency appointments? Each time a patient embarks on the journey of improved hearing, there is an adaptation period for the user's ears and brain to adjust. This period can take 30 to 45 days and is individual to each patient. In addition to the complex cognitive changes that happen when restoring hearing clarity, patients will notice significant improvement in some hearing situations and perhaps not as much in some other situations. This is common in the initial process of hearing loss treatments. I believe every patient is entitled to ongoing customizations for their technology treatment prescription throughout their treatment plan. It is important to understand any ongoing changes you may have. Keep in mind, if your technology treatment is broken or damaged due Dr. Jill E. Copley, Au.D, CCC-A 29. To non-compliance with care, protection, and maintenance, this may result in repair charges. As a simple rule, if you do your best to avoid breaking your technology treatment and follow the simple guidelines that your audiology specialist shares with you, then you should have no additional costs for customizations, even if it's an emergency, while your treatment plan is under warranty. Does the clinician make you feel special and comfortable? When you meet with your hearing healthcare provider, the person to whom you are trusting with your hearing care, you need to be in a comfortable and welcoming environment. Each employee at Total Hearing Care understands the importance of hearing and the distress that can be involved with making the decision to treat one's hearing loss. In fact, some members of my staff wear hearing devices themselves. The entire experience from beginning to end, including a welcoming staff, should be designed to help alleviate a person's feelings of anxiety. We believe every patient is special and must be made to feel that way. Every time he or she comes to one of our offices in need of hearing health care. Does the specialist have a great reputation? With the internet today, it is extremely easy to pull up ratings and reviews from patients. Simply go to Google and search for audiology reviews and ratings within your town. At the time of this report, my practice has multiple 5-star reviews on Google, Facebook, and other online sources. And don't be shy about asking for references, go direct. Lie to the source. You have the right to call any audiology office and ask for a list of references, including other patients and local physicians that have volunteered to help advise patients as they first enter the, sometimes overwhelming, world of hearing loss and to help patients understand rehabilitation experiences from the first-person perspective. 30 Inspiration for hearing well. Question number 4. How early in life should I have my hearing evaluated? The simple answer. If you are over 50, You should have your hearing evaluated. Detailed answer. I have tried to stress the importance of early diagnosis and treatment of hearing loss throughout this book and to each of my patients. The American Speech-Language Hearing Association, the American Academy of Audiology and the American Medical Association have all considered the recommendation of including hearing evaluation screening between the ages of 50 to 60 years old. Similar to going to your primary care physician every year, obtaining a baseline hearing test can help to better serve you and your clinician as a guide to the medical recommendation at current or future appointments. Obtaining a baseline evaluation and discovering that you have normal hearing never hurt anyone. Regardless of age, if you are noticing any of the symptoms of hearing loss, e.g., difficulty hearing in noisy situations, difficulty hearing the TV. Compared to others, if your family is suggesting you get a hearing test, or if you have ringing in your ears, defined as tinnitus, then it is time to take the first step and have your hearing evaluated and discuss treatment. Options. Unfortunately, waiting too long can significantly impact the expectations and outcome of treatment, and sadly every hearing healthcare clinician I know has a patient they have had to tell he or she waited too long, and the benefits of treatment will be minimal. Dr. Jill E. Copley, Au.D, CCC-A 31. 32 Inspiration for Hearing Well. Part 2. Dr. Jill E. Copley, Au.D, CCC-A 33. 34 Inspiration for Hearing Well. Question number 5. What will happen at the initial evaluation and consultation? Every process has a beginning, middle, and end. Because of the thoroughness of these appointments, they can often last 2 hours or more. The beginning. First things first, your specialist will ask you, so, tell me, what is going on with your ears? Or some variation of that why question. This helps to set the stage for understanding your specify hearing related issues, concerns, and experiences. This conversation is the baseline to helping your audiologist understand why you raised your hand and are seeking help. While my job title may be audiologist, this initial line of questioning is designed to help me better understand my patient at a deeper, more emotional level. I want to know my patient's experience with hearing loss and how it impacts her life. How does your hearing loss impact your relationship with your children or grandchildren? How does hearing loss impact your relationship with your spouse? Does hearing loss get in the way of your performance at work? Some of my patients wait their entire life to go skiing with their grandchild, and now their hearing loss is robbing them of the richness of that experience and getting in the way of developing a deeper relationship. As an audiologist, it is my job to treat your hearing loss and you as a person. Because hearing loss can impact others around you, I strongly encourage and invite a significant person in your life to attend your appointments. The middle. Treating hearing loss is a process steeped in science, engineering, technology, and clinical medicine. There is also an art to treating here. Dr. Jill E. Copley, Au.D, CCC-A 35. Hearing loss, and this skill is developed with years of experience. In order to develop the right treatment plan for each patient, there must first be the proper diagnostic procedures that test every aspect of hearing. How does the ear work? So, because I am the hearing doctor, I always want to be sure patients understand how their ears work. It is our ears' job to take in acoustic sound waves, all the sounds around us travel in invisible sound waves, and turn them into electricity, which is how our brain and nervous system communicate. Sound goes into and makes the eardrum vibrate. This is where the first energy change happens. When the eardrum vibrates, the acoustic energy changes to mechanical energy. The tiny bones attached to the eardrum also vibrate and send the energy into the inner ear, the cochlea. The inner ear is a tiny, fluid-filled space inside the temporal bone, remember, the hardest bone in the human body. The inner ear is so small, the whole thing could fit on my pinky fingernail bed. As fluid is moving, the energy is now hydraulic, which causes the tiny hair cells to move inside the inner ear in the same fashion that seaweed moves in ocean tides. That movement makes the final change to electricity, which then travels up the hearing nerve, 8th cranial nerve, and then to the auditory centers of the brain. How cool is that? Sound that goes into the right ear ends up in the left side of the brain, while sound going into the left ear goes to the right side of the brain, then the energy crosses over from each side to the other side. That is how our brain tells where sound is coming from and also helps us process speech in the presence of noise. What an amazing process, and it all happens in milliseconds. So cool. Everything that I do in the exam is analyzing how the sound is moving through all of the above processes so that I can figure out if there is a loss of energy somewhere that is resulting in your loss of hearing. If the 36 inspiration for hearing well problem is earwax, that can be removed. If the problem is in the middle ear, there may be medical or surgical treatments that are appropriate for you. If the problem is that the inner ear nerve cells are damaged, then you just may need some extra sound stimulation that will help your brain get the sound that it is missing. This is why it is so important that you see a licensed clinical audiologist so that your hearing loss is properly evaluated. In my many years of practice, I have unfortunately seen many patients that were sold hearing aids when their hearing loss could have been medically or surgically corrected. The outer and middle ear. First, your provider will look into the ear canal to make sure the ears are free of any obstructing cerumen, ear wax. This is most often followed by a procedure called tympanometry that can rule out any medical condition causing hearing loss involving the eardrum and/or the space behind it, including those tiny, middle ear bones, the hammer, anvil, and stirrup. The beeps. From there, it is important to establish the degree of hearing loss. Using the raise your hand when you hear the beep may conjure memories of having your hearing screened by the school nurse, but it still serves a purpose, establishing the degree of hearing loss. If the person stops testing you after the beeps and makes a recommendation for treating your hearing loss, I advise you to run as fast as you can. The information gathered from this test, although important, is only a piece of the puzzle. The words. The most important testing we will perform is designed to assess your cognitive hearing, e.g., how well you understand words in quiet and with background noise. After all, nobody comes to the office complaining that Dr. Jill E. Copley, Au.D, CCC-A 37. They can't hear beeps. This line of testing will truly help your clinician understand how well you hear and how well you process words and conversation. Testing a patient's ability to hear words is often referred to as word discrimination scores ability. First, the patient is asked to repeat a list of words at a near normal conversational volume. Individuals with normal hearing will always correctly repeat between 96 to 100% of the words on this test. Individuals with hearing loss will not score nearly as well. For example, Many people with a mild to moderate age-related hearing loss will typically score between 50–60%, thus the patient is expected to miss 40–50% of what is said to him or her on a daily basis, especially when visual and contextual cues are removed and only hearing is utilized. The next test is a repeat, almost exactly as just described, but performed a second time at a volume and clarity setting ideal for the specific patient's hearing loss. The result of this second round of word testing is referred to as the patient's hearing potential score. Most often the patient who formerly scored between 50–60% will now score 90% and greater. Thus, treatment with technology treatment plan is expected to improve the patient's hearing clarity to 90% and greater on a daily basis, especially in a quiet conversational setting. The patient is fully aware that he or she performed significantly better with enhanced clarity. I mentioned earlier that the consequences of waiting too long to treat hearing loss can be dire. In some cases, when the second round of word testing is completed, the patient's hearing potential score will be compromised. The score may sometimes only be as high as 50–60%, or even lower. In these cases, the outcomes and expectations for treatment become dimmer, especially when compared with the patient who scored over 90%. 38 Inspiration for hearing well. The words in background noise. The number one complaint of every patient with hearing loss, and most often the first symptom of hearing loss, is difficulty understanding speech and conversation in background noise. Thus, it is critical that the clinician understands each patient's ability to decipher speech in background noise, again, without visual or contextual cues. This test, called the Quick Speech in Noise Test, QuickSIN, is a means to quantify a patient's difficulty understanding and following speech in background noise. Briefly, the sentence intended to be heard and repeated by the listener is presented at a clear and audible volume to the patient. With each new sentence introduced, the level of background noise, often referred to as cocktail party noise, is increased in increments of 5 decibels. The final iteration of the test is when the speech and background babble are presented at the same volume, significantly taxing the auditory system and its noise reduction ability. Individuals with normal hearing are typically capable of hearing every word at each level, and some of the words at the final, most competitive level. In contrast, individuals with even a mild hearing loss can struggle significantly on this test when the noise is 10 decibels less than the intended speech. The test is scored on a hearing handicap scale and can range from normal, to mild, to moderate, to severe hearing handicap. A majority of patients with a mild age-related hearing loss will often score in the mild to moderate hearing handicap range, confirming his or her reported difficulty following conversation in complex listening situations. The end. Once all the testing is complete, it is the clinician's responsibility to review all test results with the patient and with his or her loved ones. These results are personal and can help a patient better understand the Dr. Jill E. Copley, Au.D, CCC-A 39. Difficulty he or she is dealing with on a daily basis. Understanding the results can also be just as important for family and loved ones. Although an individual with normal hearing can only imagine what it feels like to suffer from permanent hearing loss, gaining an understanding of the degree of hearing loss, hearing potential ability, and hearing handicap scores can help the loved ones gain perspective on what the patient is going through and how much of a strain hearing loss can be. These test results will determine the medical treatment plan and help initiate the journey towards improved hearing clarity and cognitive health. 40 Inspiration for hearing well. Question number 6. What if I still have questions after the initial consultation? The initial consultation can be overwhelming for some people and for their family members, and can sometimes stretch to 60 minutes or more. In these situations, it can be difficult to ask every question, to process everything that is being said, and to understand the enormity of the diagnosis of hearing loss. I believe in an open discussion and dialogue, and that many patients, and perhaps their family members, will have questions that come up even after the appointment is over. I always invite and encourage patients to bring family and loved ones to their appointment. Your family members, such as a spouse or child, or a friend, can help you remember information and ask questions, as well. Bringing lists of questions to the follow-up appointment is important. It is important that the patient and his or her loved ones understand exactly what is happening with the patient, exactly what the degree of hearing loss is, how the disorder can impact his or her life, how it can impact his or her cognitive function, and how it can impact his or her risk of developing dementia, which often leads to loss of independence and even institutionalization. At the initial consultation, there will also be a medical recommendation presented for how to treat the hearing loss. There is no one-size-fits-all treatment plan. Our technology treatment plan offers a wide array of options that are often dictated by the test results and patient's needs. Dr. Jill E. Copley, Au.D, CCC-A 41. Question number 7. When is the best time to treat my hearing loss? ASAP hearing loss is associated with increased rates of diabetes, heart disease, kidney disease, thyroid disease, problems with balance, falling, and the development of dementia. The longer you wait, the more you are depriving the brain of proper auditory stimulation, often referred to as auditory deprivation. Your brain is not getting the proper auditory stimulation and auditory cues that it needs to run at 100%. The brain is a very simple use it or lose it mechanism, and auditory input can help to provide the proper, constant stimulation our brains are accustomed to and designed to receive. Hearing is not a sense to take for granted. Yet the statistics are alarming. It is estimated that only 20% of individuals with hearing loss actually seek medical treatment. Without the proper treatment of hearing loss, the brain is being asked to constantly work on overload. In neuroscience, we call this cognitive overload, asking the brain to process auditory, visual, and other cues just to put together a simple sentence. Consider this sentence. Hi, Martha. How is your puppy doing? Is he eating and growing okay? I hope we can get our dogs together soon to play. If we filter this sentence through a typical mild age-related hearing loss with compromised clarity, e.g., difficulty hearing consonants, the sentence could be perceived as this. I, Mara, O-I-R-U-Y oing, I-E-E-A-ing and growing o, I-O-E-E and G-E Au.D o-gear u-an o-a. 42 Inspiration for hearing well. I think you will agree that this is rather alarming. Remember earlier when we discussed patients with mild hearing loss missing 50 to 60% of words at near normal conversational volume? This is what it could sound like to the patient with auditory-only cues. Of course, the brain will use visual cues, lip reading, etc. to fill in the missing pieces, but the brain was not designed to take on that much stress and effort just to understand a simple sentence. This cognitive overload is hypothesized to be one of the leading reasons that individuals with hearing loss can be 5 times more likely to develop dementia. Additionally, research indicates that even a mild hearing loss anatomically and physiologically changes the brain and its connections. However, This negative process can often be reversed within only 6 months of using technology treatment. Dr. Jill E. Copley, Au.D, CCC-A 43. Question number 8. What if I am nervous about treating my hearing loss? Undergoing treatment for any medical disorder can be overwhelming to patients and to their family members. Fortunately, today's technology treatment plan has alleviated most of the worries and concerns about treating hearing loss. The technology is specifically designed to be discreetly worn all day and fit comfortably in the patient's ear. With enhanced clarity features, background noise cancellation filters, and wireless connectivity, today's hearing loss treatment options are simple and sometimes even fun. You can connect your technology treatment to all sorts of home electronics, including light bulbs, coffee pots, doorbells, etc. But this is beyond the scope of this book. 44 Inspiration for hearing well. Question number 9. Why can't we wait until next year to treat my hearing loss? Hearing loss, for some reason, seems to be the perfect thing for patients to try and put off until next year. Patients will try to rationalize their hearing loss. Oh, this is normal for my age, or everybody mumbles. I often tell my patients, eye exams will show that you either have normal vision or you don't. If you don't, you treat it. Hearing is the same concept, either you hear normally, or you don't. If patients don't understand the unintended consequences of waiting to treat hearing loss and the medical conditions associated with hearing loss, how can they be expected to understand the importance of starting treatment of hearing loss today? Simply stated, the organ of hearing, i.e., the cochlea, has a finite amount of receptor cells, referred to as hair cells. The hair cells are akin to the rods and cones of the eye, which receive stimulation and pass along the information as a complex series of neurochemical signals to the brain. As we age, like most mammals roaming the planet, humans are genetically predetermined to suffer the effects of age-related hearing loss. This problem is becoming more prominent in our society as we live longer, more active and engaged lives. With this progressive degenerative disorder, there is a gradual, continual loss of hair cells within the cochlea. These cells each have upwards of 30 nerve fibers responsible for relaying information to the brain to process sounds and conversation. As each cell dies with age and excessive exposure to noise, compounded by the combination of the two, the cells will die, and so, too, will the attached neurons. A recent study from Johns Hopkins found significant cerebral atrophy. Dr. Jill E. Copley, Au.D, CCC-A 45. aka brain shrinkage, in the brains of individuals with hearing loss, likely the result of the progressive degenerative nature of hearing loss. The cerebral atrophy found in these individuals is reminiscent of the global cerebral atrophy observed in individuals with dementia. Treating hearing loss early has many advantages, predicated on use it or continue to lose it. Treating hearing loss cannot prevent further damage caused by our genetics or prior exposure to loud noise, but it can help maintain clarity and fine resolution of speech understanding as the disorder progresses. This also applies to considering treatment of one versus both ears. Some of my patients ask if they can just wear one hearing aid, even if they have hearing loss in both ears. Numerous studies have been done over the years to understand the impact of only using one hearing aid when the patient had equal amounts of hearing loss in both ears. The results are definitive. 2 ears are better than 1. The untreated ear's ability to perform word discrimination tasks is significantly reduced compared to the treated ear. Looking back on these results, they almost seem like common sense. The brain was designed to receive input from two ears and can respond adversely if only stimulated by one. I often joke with my patients who ask, "Do I have to treat both ears?" by asking them, "Is it easier to have one arm or two?" In all seriousness, the importance of treating hearing loss early cannot be understated. Maintaining the strength and vitality of neural connections of the ear to the brain is key to the successful treatment of hearing loss. 46 Inspiration for Hearing Well. Part 3. Dr. Jill E. Copley, Au.D, CCC-A 47. 48 Inspiration for Hearing Well. Is there an ideal patient? The ideal patient is a person who understands both the medical and personal consequences of untreated hearing loss. A person who understands that her hearing loss is not just about him/her, but understands that hearing loss impacts his/her entire family, their group of friends, and their community. An ideal patient is somebody who is daily invested in his/her life, somebody who is invested in active aging, somebody who is invested in living independently, somebody who wants to stay engaged and who wants to be a part of the conversation, somebody who wants to be a part of his/her family and who wants to remain involved in their community. The ideal patient has to accept the cost-benefit ratio when it comes to treating hearing loss, and I hope that this book helps patients understand that it's nearly impossible to put a dollar value on improved health. I believe the ideal patient truly wants to stay involved, wants to grow, wants to remain independent, and wants to make the most of every day and every relationship that he or she has. That is an ideal patient. If you are, or know someone that fits this description, please help them begin treatment of their hearing loss as soon as possible. I suppose on the other side of the coin is the not ideal patient, the person who has his wife, his kids, and his grandkids basically pushing him into the office. That's not an ideal patient, although we have helped motivate many of them to realize what they need to do for themselves and their families. This type of patient must realize the severity of their situation and they must want to make a change. As you know, you can lead a horse to water, but you can't make it drink. Dr. Jill E. Copley, Au.D, CCC-A 49. Question number 10. What treatment options are available to me when I'm ready to start treating my hearing loss? I get this question often as I am out and about in the community meeting new patients, and even from family and friends. My answer is always the same: technology treatment plan. Advances in technology specifically designed to treat the cognitive aspects of hearing loss, not just make things louder, have significantly improved patient care and patient satisfaction. But my next response is always you must see a total hearing care provider to determine which form of technology treatment plan suits you and your hearing loss best. While the most important factor in determining treatment is always based on the patient's hearing profile and healthcare history, specific options can be based on several factors including addressing specific patient symptoms, difficulty in certain acoustic environments, tinnitus, etc., dexterity, can the patient manipulate the hearing device, and personal preferences, color, size, etc. Your hearing healthcare provider can help you understand which form of technology treatment plan, what shape and size, and which specific features can help you hear your best and keep you engaged in conversation. 50 Inspiration for hearing well. Question number 11. What treatment options are available for the ringing in my ears, aka tinnitus? As a clinical audiologist, one of the most common questions and complaints I get from my patients is about the ringing in their ears. Tinnitus, pronounced either tinnitus or tinnitus, is defined as a sensation of sound in your ears, sometimes in your head. Each person with tinnitus has a different sound experience. For most it is described as a ringing sound, but many patients also report a shooshing, buzzing, or whooshing sound similar to the sounds inside a conch shell. I have experienced tinnitus. This experience has certainly made me empathetic to anyone who suffers from tinnitus. Imagine a loud ringing sound that you just cannot get away from, day or night, regardless of how loud sound is around you. Tinnitus is responsible for many sleep-deprived nights. Oftentimes, technology in both ears helps the brain be less aware of the ringing. I am always on the lookout for treatments that can be a help to me and my patients. It is currently estimated that nearly 50 million American adults live with tinnitus. Tinnitus is experienced by approximately 80% of people living with hearing loss. In some people, the tinnitus can interfere with daily life and result in depression, anxiety, and affect concentration. Too many people dismiss the ringing, when in fact this sound essentially represents an internal alarm alerting you that something is not as it should be. Whether the tinnitus is constant, only noticeable in a quiet room or at night, pulsating or seems to have certain triggers, i.e., exercise or caffeine, it is important that the root cause of the problem be determined and a proper treatment plan be put in place with your hearing healthcare specialist. Dr. Jill E. Copley, Au.D, CCC-A 51. What is the cause of tinnitus? The most common cause of tinnitus is damage to the sensory organ of hearing, the cochlea, i.e., the inner ear. The cochlea is to hearing what your retinas are to vision. Within the cochlea are tiny nerve cells called hair cells. When these cells are damaged, the nerves that connect the hair cells to the brain and give us the ability to hear become permanently damaged, and oftentimes the ringing will ensue. How do the sensory cells in my ear get damaged? The sensory cells in the ear are most vulnerable to aging. Think about it, as we get older, we tend not to see as well or see as sharply as we used to, especially in low-light environments. Unfortunately, the same process happens in our ears as we age. We tend not to hear as clearly, especially in noisy situations. Another common cause of tinnitus is excessive noise exposure, either a single intense noise, like a shotgun blast or an airbag, or long-term exposure either from work or play, e.g., musicians, concert attendees, carpenters, machinists, landscapers, etc. But why do my ears ring? Tinnitus is most often the result of a central gain in neural activity that occurs when there is a loss of proper neural stimulation from the ear to the brain. More simply, when the brain is not stimulated in the case of individuals with hearing loss, even a mild hearing loss, the brain will increase activity to make up for the missing input. This central gain is neurologically analogous to phantom limb phenomenon studied in neuroscience. In cases where damage occurs to the peripheral nervous system, such as when a soldier loses a limb in battle, the central nervous system, aka the brain, will undergo adaptive changes that can often result in the perception of pain. Our ears perceive. 52 Inspiration for hearing well. Tie-on of pain is the ringing. The damaged hair cells are sending incorrect chemical and electrical signals to the brain that is interpreted as sound in the absence of a true auditory stimulus. Treatment for your tinnitus. Unfortunately, too many patients have said to me, "I have tinnitus, and I've been told there is nothing that I can do about it." I emphatically say to each of these patients, that is not true. Is there a cure for tinnitus? No. Are there recognized FDA-approved treatment options available to reduce, and in some cases, eliminate, the ringing? Yes. The single most effective treatment option available for patients suffering with tinnitus is a technology treatment plan. The FDA, Food and Drug Administration, has approved treatment for individuals with tinnitus by providing the brain with restored proper stimulation. And while most people with tinnitus also suffer with hearing loss, that is not always the case. Fortunately, newly available technology treatment has been designed for people with tinnitus who have hearing loss and for individuals with, so-called, normal hearing. Many studies show that patients who use the tinnitus support technology note a significant reduction in their daily tinnitus experience, with some even reporting that the ringing is gone all day. Dr. Jill E. Copley, Au.D, CCC-A 53. Question number 12. What if I have total hearing loss in one of my ears? And what is a crow's system? As a general rule of thumb, hearing ability in the two ears should be near equal to each other. After all, your ears are the same age. If you have a history of noise exposure, it was likely the same in both ears, and if you were prescribed a medicine with a side effect that could impact hearing, it will impact both ears similarly. But, in some patients, hearing in one ear will diverge from the other. This can result from a host of otologic issues, including viral infection of the ear, physical trauma to the ear, and of unknown origin, medically diagnosed as idiopathic hearing loss. According to the Merriam-Webster dictionary, idiopathic means arising spontaneously or from an obscure or unknown cause. The separation of hearing levels between the two ears can sometimes be dramatic or even complete. Unfortunately, some patients have a dead ear, medically defined as anacusis, with normal hearing in the other ear. In other patients, there is an asymmetric hearing loss which implies hearing loss in one ear and even worse hearing in the other ear. The brain was designed to hear with two ears, and it will function best with equal hearing in both ears. Binaural, two-ear, hearing has significant benefits that include increased sound localization ability, e.g., figuring out where sound is coming from in the room, and enhanced perception of speech in noisy situations. These characteristics of binaural hearing are often referred to as the binaural advantage. If you know somebody with lopsided hearing loss, you will notice that they always strategize to improve the listening environment by having the person speaking on their better hearing side. 54 Inspiration for hearing well. While the course of treatment for individuals with significantly poorer hearing in one ear is different than the patient with symmetrical hearing loss, a technology treatment plan can be used to significantly enhance hearing and understanding in all listening situations. Briefly, the most common technology treatment used in these cases is referred to as a crow's system. Crow's, contralateral routing of SIG. Now, we'll take sound from the dead worse side and route it over to the better side, even if there is some hearing loss in the better side. Using this technology allows the patient to access sound on the, otherwise, muted side of the body. While this patient may never perform as well as an individual treating equal levels of hearing loss in both ears, restoring perception of sound from the muted side of the body can offer significant relief in almost all listening situations. Dr. Jill E. Copley, Au.D, CCC-A 55. Question number 13. Do they still make traditional hearing aids? Yes, Traditional hearing aids are still made. Mostly this traditional technology has been relabeled and is now masquerading as new over the counter, OTC, technology or personal sound amplification devices. PSAPs. Unfortunately, because the words hearing aid are very general and very common, it can be quite confusing for the patient. As I explain to my patients nearly every day, your father or grandfather wore traditional hearing aids, and he probably hated them. This older technology was intended to make sounds louder regardless of location in the room, regardless of the volume of the incoming sounds, and regardless of what the patient did or didn't actually want to hear. As an audiologist seeing patients early on in my career, I was very disappointed by the limitations of the traditional hearing aid technology, but it was all that we had at the time. 56 Inspiration for hearing well. Question number 14. So, what's the deal with new hearing aids and a technology treatment plan? Most new hearing aids are a technology treatment plan. In the last 10 years or so, there have been giant leaps and bounds in prescription hearing aids towards improving listening experience for the patient, and thus increasing patient satisfaction. Around this time, the average patient satisfaction rating for traditional hearing aid experience was hovering around 70% to 75%, as measured by the MarkTrack survey. If you now fast forward another 10 years to present time, the most recent MarkTrack survey examining patient satisfaction with hearing loss treatment has shown an improvement to 91%. I believe this number speaks for itself. Treatment of hearing loss with traditional hearing aids is, thankfully, beginning to be phased out and replaced with an advanced technology treatment plan that is designed to enhance hearing in all listening situations, enhance clarity of speech details, automatically provide an increased boost of volume for soft speakers, stimulate the brain, and increase cognitive function. Dr. Jill E. Copley, Au.D, CCC-A 57. Question number 15. What in the heck is an invisible hearing aid? Modern technology treatment plan hearing aids are really hard to see on most patients. Like Wonder Woman's invisible jet plane, you can't see it, but it is really cool. I get questions about this all the time from patients. What is an invisible hearing aid, and will my friends be able to see it? When treating hearing loss with a technology treatment plan, I have two principles that I always follow. 1. Use the right technology treatment plan to treat the patient's hearing loss and improve cognitive health. 2. Respect the patient's desire for a technology treatment plan that is physically and aesthetically comfortable for them. But principle number 2 can never override principle number 1. As a general rule of thumb in the tech world, the size of technology decreases over time. Advanced technology treatment uses smaller, more powerful digital technology and processing to automatically adapt to the user's surroundings. I have always believed that treating hearing loss should require minimal effort from the patient. The hearing-impaired person needs to start using technology treatment when he or she wakes up in the morning and then simply remove it before falling asleep and do nothing in between. Advanced technology treatment has ushered in the age of effortless hearing loss treatment. Advances in design and technology allow for the user to be hands-free, no more buttons for environment, i.e., push the button twice when in a noisy restaurant, push 3 times when in the gym, push the button 4 times when on the phone, etc., and no more spin wheels to adjust. 58 Inspiration for hearing well. The volume up and down. Innovations in technology treatment allow for automatic adaptation to dynamic environmental listening situations, e.g., listening to speech as you go from a quiet room to a noisy room, and it can automatically adapt to incoming volume to maintain the NOR. Malfluctuations in the volume of voices and background noise. The most advanced feature of technology treatment is noise cancellation that delivers increased access to clear speech in noisy listening situations. More on this in the bonus question. While technology treatment is the circuitry inside the device, the device can come in different shapes and sizes to best fit your hearing loss and your ear. Technology treatment plan options for treating hearing loss. Invisible treatment options. Once placed in your ear, this technology is hassle-free. You may even forget you're wearing the device. And that's the point. Hearing loss shouldn't hold you back, and neither should your hearing solution. Features in today's invisible technology options include an invisible and custom fit. Low battery reminders. Devices can remind you in your ear, your phone, if compatible, by text or email that your batteries, or your loved one's batteries, are low, and as of this writing, deeply fit completely in the canal. Devices only use replaceable batteries, not rechargeable ones. Easy adaptation to new sounds with automatic volume control and adaptation to the listening environment. Dr. Jill E. Copley, Au.D, CCC-A 59. Wireless streaming to your compatible smartphone to keep you connected to your TV, music, and other media. Sound comfort technology is designed to provide distortion-free listening comfort for loud sounds while ensuring ultimate clarity. Mini receiver in the ear options. Groundbreaking technology treatment is fast and precise enough to analyze and follow the dynamics of the entire auditory environment and differentiate between speech and background noise, briefly, and without getting too lost in technical details. Technology treatment is capable of sampling sounds in the environment 100 times, or more as technology advances, per second, to decide on how to optimally perform and restore clarity, whereas traditional hearing aids were barely capable of analyzing the sound environment and capped out at a sampling rate of less than 5 times per second. Advances in miniaturization of technology treatment have led to the breakthrough of new technology found to support brain function, including working memory, selective attention, and processing speed. See bibliography section for report from Dr. Desjardins, University of Texas, El Paso. These new devices have 3 features designed specifically to maintain the brain's innate ability to hear in all different listening situations. Clear hearing in background noise. By separating important speech from background noise by as much as 10 decibels, this new technology provides 30% better speech understanding and clarity in noise. Enhanced clarity equals enhanced memory recall. Individuals with hearing loss can have difficulty with working memory, thought to be the result of distorted auditory input to the brain. An advanced technology treatment plan can provide 20% more capacity to recall. 60 inspiration for hearing well. And remember words by increasing the clarity of the signal being processed by the brain. Reduced mental effort. Many patients describe hearing loss as being exhausting. Normal hearing is relatively effortless in most listening situations. But to an individual with hearing loss, even a simple conversation at work with a colleague or while out skiing with the grandchildren can require major effort and use of all available mental resources, including lip reading. Neurotechnology can offer the hearing-impaired user relief by reducing the cognitive load, e.g., mental effort, by 20%, making the conversation significantly easier to follow in all situations. Other features include hands-free wireless surround sound hearing on compatible smartphone. Rechargeable batteries. No more batteries going dead at inconvenient moments. No more batteries dropped on the FL or no more unexpectedly running out of batteries at a critical moment. The devices are recharged nightly by putting them into a special charging case and can last up to 18+ hours on a single charge. Wireless compatibility with any TV to enhance the clarity of the signal. Let's join in with all current advanced technology treatment plan users and celebrate. Gone are the days of clunky beige banana hearing aids. Dr. Jill E. Copley, Au.D, CCC-A 61. 62 Inspiration for Hearing Well. Part 4. Dr. Jill E. Copley, Au.D, CCC-A 63. 64 Inspiration for Hearing Well. Question number 16. How much will my new ears cost me? Answer: it depends. Throughout this book I have alluded to technology treatment plan options as the gold standard of treating hearing loss. Specific recommendations will rely on a number of factors, e.g., degree of hearing loss, symptoms, amount of time living with untreated hearing loss, etc. However, with that said, I have over 20 years of horror stories of patients trying to save a buck. I know patients who have thrown away $30, $300, even as much as $3,000 on a sound machine in their ear that amplifies volume. Some have tried traditional hearing aids that only make sounds louder, some have tried online or over-the-counter, OTC, devices, some have tried personal sound amplifiers, PSAPs, some have even tried mail-order hearing aids. I take no issue with patients trying to save money and make good economic decisions, but even with healthcare, you get what you pay for. Treating the progressive degenerative nature of age-related hearing loss is no different than treating other major medical disorders as you age. As an example, imagine yourself, or a loved one, in a situation where hip replacement surgery is required. Could you imagine your surgeon asking the following question? Would you like me to replace your hip and restore 30%, 70%, or maximum percent mobility? Here is another example. Imagine saying to your heart surgeon, after she lets you know that you are required to undergo triple bypass and heart valve replacement. Doc, if you don't mind, I'm going to shop on Amazon for a replacement valve to try and save a few bucks, even if it doesn't pump. Dr. Jill E. Copley, Au.D, CCC-A 65. The adequate amount of blood to keep my body oxygenated and healthy. While both scenarios may seem far-fetched and ridiculous, unfortunately the retail aspect of hearing healthcare has poisoned the well for too many people living with hearing loss and has made treating hearing loss a very confusing, onerous process for the patient. We trust all of our healthcare providers to use their knowledge and experience to provide us with the best, most medically sound treatment recommendation, regardless of price. You should expect the same from your doctor of audiology. If your clinician is reputable, e.g., is referred to by local physicians, has many 5-star reviews on Google, has readily available current patient liaisons to speak with, etc., and has longevity in the community, then you can rest assured that their pricing structure is standard and that the only variable is the cost of technology, preset by the manufacturer. A technology treatment plan is the #1 most effective, FDA, Food and Drug Administration, approved treatment for hearing loss and has the highest recorded level of patient satisfaction. 66 Inspiration for Hearing Well. Question number 17. What is the cost of not treating my hearing loss? Answer: possibly a lot more than you think. Throughout this book, we have discussed the positive impact of treating hearing loss and the dire consequences of not treating hearing loss. It is difficult to assign a true monetary value to both of these scenarios, but I will give it my best shot. Here are two examples. 1. Hearing loss can increase the risk of developing dementia by 2x to 5x, depending on the severity. Treating hearing loss is reported as the single most effective modifiable risk factor to preventing dementia. Given these two medical research findings, it is not unreasonable to calculate the cost of treating a patient with dementia that could have possibly been avoided by treating his or her hearing loss at an earlier age. Statistics show that the average family will spend approximately $57,000 per year to cover healthcare costs and manage the care of a loved one with dementia. 2. Hearing loss increases the risk of falls in seniors. Treating hearing loss can significantly reduce the risk of falling. Again, given these two medical research findings, it is not unreasonable to calculate the cost of treating a patient who falls and compare it to the cost of treating hearing loss. Falling over the age of 65 is the number one cause of injury-related deaths. And once a person falls, he or she is 2 times more likely to fall again. The Center for Disease Control and Prevention, CDC, estimates that the average medical cost associated with a fall that results in hospitalization is over $30,000, and the cost of treatment increases with age. Dr. Jill E. Copley, Au.D, CCC-A 67. In addition to dementia and falls, comorbidity of hearing loss, i.e., other diseases that are correlated with hearing loss, extends to diabetes, coronary disease, thyroid disease, and others. 68 Inspiration for hearing well. Question number 18. How do I pay for my new ears? How much you will have to pay out of pocket depends on several factors, including the technology treatment plan recommended, the procedures involved, and, of course, the specifics of your insurance policy. Some patients are able to pay in full by credit card or check. However, some of my patients pay for their treatment by utilizing Creative Bean. For example, using their health savings account, HSA, flexible spending account, FSA, financing at 0%, using tax returns, and even using the cost towards their medical expenses benefit on their tax returns. Warning: I am not an accountant and do not even play one on TV, so always ask your accountant how to best proceed with all tax matters. How to use flexible spending and eliminate the headache of using it. Just to make sure we are all on the same page, flex spending may be accessible through your work benefit package. It allows you to set aside a certain amount of money per year, tax-free, to be used for medical expenses. Treating hearing loss is a medical expense. Step 1. Sign up early. Perhaps you already follow the 5 Ps to success. Proper planning prevents poor performance, but in case you don't, this is one thing you want to plan early so you can maximize the benefit. Many employees set higher limits than you think on the amount of flexible spending dollars you can contribute and access. I have seen employees with as much as $2,500 and some with even $5,000 in flex spending dollars available to them. Failure to sign up early could cost you more in out-of-pocket medical expenses, especially. Dr. Jill E. Copley, Au.D, CCC-A 69. If your plan is not up and ready before you or a loved one needs to treat his or her hearing loss. If you have a new plan, work with your human resource contact to sign up early for next year in order to maximize your savings. Step 2. Notify your employer of family status change. Different employers have different sign-up deadlines for their flexible spending plans, but typically, at the beginning of the year your employer asks how much money you want to contribute for the year. The problem with making annual decisions about healthcare coverage is obvious: life happens, and sometimes it's nearly impossible to plan ahead that far. You may apply for a family status change for changes such as marriage, birth, divorce, or loss of a spouse's insurance. These are opportunities to add more coverage for hearing loss treatment expenses. Step 3. Choose wisely. Finally, give some thought to calculating how much money to contribute to your flexible plan at work this year and every year. If you are considering hearing loss treatment for you or a family member, visit the specialist's office for an initial consultation. Your hearing care provider can help you plan exactly how much money you should contribute to help reduce your out-of-pocket costs when it is time to pay for and receive your technology treatment plan. Step 4. Use it or lose it. Here's something you may not know, and frankly, has always puzzled me. If you put more money into your flex spending account than you need or use, by law, you lose the money. Yikes. But some employers allow a grace period to give you more time at the beginning of the year to submit claims for eligible medical expenses. 70 Inspiration for hearing well. From the previous calendar year. Any money left in your account after this grace period is forfeited. To finance or not to finance? Tease the question. As a human being with a family, home, and many other fiscal responsibilities, I understand the difference between things I need to buy and things I want to buy. Treating hearing loss is something that my patients need to invest in to ensure proper hearing and cognitive health. But not every patient is able to pay for treatment up front in a lump sum. A respectable hearing specialist will be able to offer their patients the opportunity to finance. I can't provide the details of every office or every offer, but these are the common financing options I have come across. 0% interest for as long as 12 months. Interest-bearing plans with locked-in monthly payments for 3 to 5 years. Use of personal credit cards or credit unions which may have lower interest rates based on your own credit history. Are there other types of financing? Total Hearing Care is offering an option to their patients that offers a manageable monthly payment that allows access to hearing treatment. I have worked to remove barriers for my patients to invest in proper hearing health care. I also recognize the dilemma current patients face when they have to upgrade from traditional hearing aids to a technology treatment plan. This plan allows patients to make a small initial down payment with recurring, fixed payments. This structure has several benefits that include Dr. Jill E. Copley, Au.D, CCC-A 71. Upgrade to a new 4-year technology treatment plan as future generations become available. Your first upgrade has a price lock guarantee. It remains at the price as your first technology treatment plan. Complete warranty coverage that includes damage and loss coverage during the 4-year technology treatment plan program. Free service, free annual hearing screenings, and free supplies, domes, filters, cleaning supplies, and more. This is a fantastic resource for patients to be able to access premium level treatment plans with a fixed monthly cost. 72 Inspiration for hearing well. Question number 19. Does my insurance cover the cost of my technology treatment plan? This is a loaded question, and one that I can only answer in general terms because health insurance coverage is a complex, ever-changing set of rules, regulations, and specifics that make it impossible to make a blanket statement regarding your coverage. Like any major medical procedure, audiology procedures can cost several $1,000s, not all of which are covered by your insurance, depending on your plan. After 30 years of patient care and working with nearly every flavor of insurance coverage, these are my 3 takeaway messages. 1. Medicare does not provide coverage for evaluations for the purpose of determining if you will need technology for your hearing loss, nor will it cover technology treatment plans. 2. Nearly every other insurance plan will cover the cost of the comprehensive hearing evaluation. 3. Some patients have some coverage for the cost of treatment, e.g., technology treatment plan. I acknowledge that nearly every and some are vague terms, but this is the world of insurance, in which we currently live. I have worked with patients that have $100 of coverage and some with 100% coverage. At my office, our insurance coordinators will work with the patient and their insurance company to maximize the patient's benefits and coverage. Dr. Jill E. Copley, Au.D, CCC-A 73. Tip: do not be afraid to pick up the phone and ask your insurance company point blank, do you cover the cost of treating hearing loss? Also, don't be afraid to call back and ask again. You would be shocked how many times our office has called insurance companies seeking this answer only to get a different answer each time we call. 74 Inspiration for hearing well. Bonus section. Number 20. Has there been research into the relationship between hearing loss and dementia? Age-related hearing loss is a progressive and degenerative disorder resulting from the loss of receptor cells, i.e., the hair cells, in the ear. Consequently, there is a significant reduction of the quantity and quality of neural connections from the ear to the brain. This slow-onset disorder can have a significant impact on several key brain areas, including the memory, hearing, speech, and language portions of cognitive function. Several key research studies have pointed to the potential links of hearing loss and dementia, including the groundbreaking work from Dr. Franklin and his colleagues at Johns Hopkins Medical Center that indicate hearing loss can increase the risk of dementia by 200 to 500%. Summary data of relationship of hearing loss and increased risk of developing dementia. Dr. Jill E. Copley, Au.D, CCC-A 77. The initial report, first published in 2011 by scientists at Johns Hopkins Medical Center and the National Institute on Aging, found that individuals with hearing loss, when compared to participants with normal hearing, are at a significantly higher risk of developing dementia as they age. The relationship between hearing loss and increased risk was rather simple. The more hearing loss they had, the higher the likelihood of developing the memory-robbing disease. A lot of people ignore hearing loss because it's such a slow and insidious process as we age, Dr. Lin says. Even if people feel as if they are not affected, we're showing that it may well be a more serious problem. 3 risk factors associated with hearing loss and dementia include social isolation, cerebral atrophy, and cognitive overload. Social isolation. The impact of reduced social and physical activity. Withdrawal from social situations is common in individuals with hearing loss. Many studies cite feelings of embarrassment, fear of making mistakes in conversations, and feeling like you are not part of the conversation as the common rationale for individuals with hearing impairment to separate themselves from family, friends, and community. This retreat from social activity has even been found in individuals with a mild degree of hearing loss. In addition, individuals with hearing loss are less likely to engage in physical activity. Both increased social isolation and reduced physical activity are strong risk factors for the development of dementia. Blindness separates you from things, deafness separates you from people. Helen Keller. 78 Inspiration for hearing well. Active aging, how to reduce social isolation. Active aging, the process of optimizing opportunities for better health, continuing development of knowledge, and increased security in order to maximize quality of life as you age. The word active is used to describe a person's involvement with social, physical, economic, spiritual, and civic affairs. We all share the same goal to maintain autonomy and independence as we age, and thus we must rely on preserving the tenets of interdependence, socialization and reliance on family and loved ones, and intergenerational solidarity, maintaining companionship with age-matched peers, to ensure active aging. Both social isolation and depression are risk factors for the development of dementia, and both increase as we age. Being a lifelong learner and staying active is important to maintain a healthy, active brain, and can also reduce your risk of cognitive decline and dementia. Some studies have shown that social activities, larger social networks, and a history of social contact are associated with better cognitive function and reduced risk for cognitive decline. Tips for active aging include: sharing a meal with family and friends 3 to 5 times per week. Committing to an aerobics exercise regimen. Learning a new hobby each year. Playing an instrument, or learning a new instrument. If you love to read, keep reading, and try to mix up the topics. If you don't read much, try to read a book every other month. Participating in classes at your local senior center. Volunteering at a local hospital, shelter, etc. Dr. Jill E. Copley, Au.D, CCC-A 79. Going back to school. Many local state universities offer free tuition to people over 65. Cerebral atrophy, aka brain shrinkage. The association of a shrinking brain, resulting from the loss of neurons, with dementia has been long documented. Even people with MCI, mild cognitive impairment, show signs of cerebral atrophy. In recent years, scientific studies using advanced brain imaging techniques, including fMRI functional magnetic resonance imaging, have demonstrated that hearing impairment is associated with accelerated brain atrophy in both the overall brain, as well as even more advanced reductions in volume associated with the memory, hearing, speech, and language portions of the brain. Individuals with hearing loss can experience significant cerebral atrophy. The most significant reduction in cerebral volume occurs in areas involved in memory, hearing, speech, and language. Schematic representing the potential cerebral atrophy in an individual with age-related hearing loss. 80 Inspiration for hearing well. Cognitive overload, i.e., working your brain too hard in order to hear. Hearing loss is not normal, and neither is the excessive strain that it can put on your brain. If you or somebody you love is experiencing hearing loss, You can observe this strain by watching the amount of effort required to follow a conversation. Patients will often joke and say, "I need to put my glasses on so I can hear you better," requiring these extra visual and lip reading cues may seem a natural way to fill in the missing speech details, but long-term, these coping mechanisms may have harmful effects on cognitive function. With hearing loss, the brain is constantly on overload trying to fill in the missing pieces and follow the conversation. Increased cognitive load is considered a risk factor for developing dementia. Cognitive load, as measured by pupillometry, i.e., the size of the pupils indicates the amount of mental effort, can quantify how hard your brain is working to follow a conversation. Recent studies have found that individuals who treat their hearing loss with a standard of care technology treatment plan do not work as hard to listen, i.e., have a reduced cognitive load, and have as much as a 20% increase in memory recall when following a conversation, even in noisy environments. Dr. Jill E. Copley, Au.D, CCC-A 81. Question number 21. Can I reduce my increased risk of developing dementia by treating my hearing loss? As I discuss the relationship of hearing loss and dementia with my patients, each seems to have the same follow-up question for me. If I treat my hearing loss, can I prevent or reduce my risk of developing dementia? Thankfully, the data appears to be trending towards a sounding yes. Recent reports have found a significant positive impact of treating hearing loss on cognitive health. Treating hearing loss and the impact on cognitive function. In a recent study investigating the relationship of treating hearing loss and cognitive function, it was found that current hearing loss treatments can improve brain function in people with hearing loss. It is understood that hearing loss, if left untreated, can lead to emotional and social consequences, reduced job performance, and diminished quality of life. Recently, studies have even shown that untreated hearing loss can interfere with cognitive abilities because so much mental effort is diverted toward understanding speech, i.e., cognitive overload. The research was aimed at measuring core cognitive functions in subjects in their 50s and 60s beginning hearing loss treatment for the first time. After only 2 weeks of treatment, cognitive testing began to reveal a significant increase in scores for recalling words in working memory and selective attention tests, and that the processing speed for which participants selected the correct response was significantly faster. In summary, after only a couple of weeks, participants exhibited significant improvement in their cognitive function. 82 Inspiration for hearing well. Treating hearing loss and the impact on risk of developing dementia. Since 2011, multiple long-term studies have provided strong evidence that treating hearing loss may eliminate the increased risk of developing dementia. Dr. Anil K. Lalwani at Columbia University noted that treating hearing loss may offer a simple, yet important, way to prevent or slow the development of dementia by keeping adults with hearing loss engaged in conversation and communication. Perhaps the most definitive report comes from the Lancet Commission, which presented a new life course model documenting potentially modifiable risk factors for dementia. The Commission's 2020 report suggests that treating hearing loss is the single most effective modifiable factor to preventing dementia. Other modifiable factors include reducing depression, increasing physical activity, and reducing social isolation, each of which is positively impacted by treating hearing loss. Dr. Jill E. Copley, Au.D, CCC-A 83. Question number 22. Can I really expect to be more socially active and engaged once I start treating my hearing loss? Yes. Throughout this book, I have been providing countless examples of how treating hearing loss can profoundly impact a patient's life and mental health. Frankly, connecting the dots of treating hearing loss to improvements in overall health and personal independence is simple. If you ask your primary care physician, "Doc, what do I need to do to be healthier?" the answer is guaranteed to include reducing stress, increasing physical activity, staying socially active and engaged, losing weight, and eating healthy. Treating your hearing loss can help you achieve most of these goals. And achieving these goals is the key to healthy active aging. There are countless medical studies that find that people who do not treat hearing loss suffer from increased rates of depression, decreased socialization, and decreased physical activity. As an example, the National Council on Aging reported that individuals who do not treat hearing loss suffer from depression, anxiety, and decreased social activity. In contrast, individuals who proactively treat their hearing loss find improvements in relationships with family members, spouse, children, grandchildren, etc., increases in feelings of self-esteem, and improvements in overall quality of life. Connecting the dots of treating hearing loss and improving your life. Treating hearing loss can increase physical activity, reduce stress and anxiety, help with losing weight, and ultimately mean living a healthier and more independent lifestyle. 84 Inspiration for hearing well. Treating hearing loss can increase clarity of speech and the ability to follow conversation in background noise, increase socialization, help reduce the risk of depression, and ultimately mean living a healthier and more independent lifestyle. Treating hearing loss can increase auditory and environmental awareness, and decrease the risk of falls, and ultimately mean living a healthier and more independent lifestyle. Treating hearing loss can increase cognitive function, can reduce the increased risk of developing dementia, and ultimately mean living a healthier and more independent lifestyle. Hearing loss can be isolating for so many people for a multitude of reasons. But it doesn't have to be. If you've made it this far through the book, you have come to understand the importance of treating hearing loss and taking care of your brain and how these two are connected. I wish you luck and happiness as you embark on the journey of treating hearing loss, restoring clarity, increasing independence, and keeping a healthy and fit brain. Dr. Jill E. Copley, Au.D, CCC-A 85. 86 Inspiration for hearing well. Epilogue. You had questions and I hope I've provided answers. So, there you have it. My patients' most popular questions answered. For your convenience, I've included a handy FAQ directly after this epilogue that summarizes most, if not all, of the questions we've just covered. Consider it a handy quick reference of sorts. The fact is, no book can ever answer every question for every patient. Every case is unique, just as every patient with hearing loss that I treat is different. What I've tried to do is provide you with the basics and hopefully the confidence. You'll need to ask further questions of your own hearing health provider when the time comes. This is your hearing, your brain, and your overall health we are talking about here. Never be afraid to insist on being heard and having your questions answered by your clinician. Now that you're armed with the answers for today's most frequently asked audiology questions, you can innerly make the right decision for you or a loved one when embarking on the journey of medical treatment for hearing loss. To take the next step, schedule your hearing evaluation and consultation. FAQs. What might happen if I wait to treat my hearing loss? Even mild hearing loss can be a major problem for a number of reasons. Hearing loss can increase the risk of developing dementia and is correlated with several other major diseases including diabetes, coronary disease, kidney disease, and increased risk of falling. Early treatment also improves the prognosis and expected outcomes. Who are some famous people who've invested in treating their hearing loss with technology? The list is quite long. A much abbreviated list includes Presidents Reagan, Clinton, and George H.W. Bush, and other celebrities and famous athletes including Huey Lewis, Lou Ferrigno, William Shatner, Pete Townshend, Whoopi Goldberg, Derek Coleman, Congressman Jim Ryan, Phil Collins, and Brian Cohen. Will I be able to afford a technology treatment plan? Yes. Not only are hearing loss treatment options more affordable than ever, but insurance, payment plans, flexible spending accounts, and a variety of other financing options make this an all but moot point. Will being FIT with a technology treatment plan be painful or obvious to others? No and no. Advances in miniaturization of technology have helped develop the most lightweight, discreet, and sometimes completely invisible technology ever used to treat hearing loss. Will I have to miss work or other social activities once FIT with a technology treatment plan? The initial comprehensive evaluation and treatment procedures will take between 2 to 2.5 hours. Follow-up visits after that will. Dr. Jill E. Copley, Au.D, CCC-A 91. Only take 30 minutes to an hour, or shorter. Patients walk out of the office after the first appointment and go about their lives, only now they can hear much better. Is it really such a big deal if I don't treat my hearing loss? Yes. Too many people believe that their hearing loss is normal for their age. There is no such thing as normal or age-corrected hearing loss. I often compare it to vision. Either your eyesight is normal, or it isn't, and you wear glasses. The same with hearing loss, either you have it or not, and if so, then treatment is needed. Hearing loss is a progressive degenerative disorder that will continue to negatively impact your life and cognition the longer it goes untreated. What are some of the warning signs that I may have hearing loss? Early symptoms of hearing loss include difficulty following conversation in background noise, experiencing tinnitus, ringing in the ears, having to turn up the TV louder than others need it, asking people to repeat often, finding yourself needing to read lips to hear better, difficulty understanding on the phone, and your family bugging you about getting help. What kind of side effects can result from not treating my hearing loss? Untreated hearing loss is implicated in increased risk of falls, increased risk of developing dementia, diabetes, coronary disease, depression, as well as increased stress and reduced physical activity. Why should I choose a specialist to treat my hearing loss? Hearing loss is a major medical condition and has been listed as the third most common medical disorder impacting seniors. Unfortunately, 92 inspiration for hearing well. Loopholes in many state and federal laws allow for traditional hearing aids to be sold online and in retail establishments, including some of the big box discount stores. These traditional hearing aids are most often older models and are only designed to amplify sound. A prescriptive technology treatment plan, designed to treat the cognitive aspects of hearing loss, is the gold standard and considered best practices by audiologists and board-certified specialists in private practice audiology clinics. How do I know if my hearing care provider is a doctor of audiology? This is typically pretty easy to figure out by searching the internet or even calling the office. I've never been bothered by a patient calling to confirm my credentials prior to his or her arrival. In fact, I believe this shows a proper amount of due diligence on the part of the patient and a true investment in his or her hearing health care. Most states will also provide a list or search tool online to find licensed and certified providers. What is a patient care coordinator? A patient care coordinator is someone with whom to schedule appointments, confer with for rescheduling, and, of course, help you get answers to any, and all, questions you may have at any point in the process. Why are follow-up visits important? These are wonderful opportunities to ask questions you may have. Missed the first time, get further details from your specialist, and bring a family member to learn about your diagnosis and treatment plan. Dr. Jill E. Copley, Au.D, CCC-A 93. Why is early treatment so important? We recommend adults 50 and older to have a comprehensive hearing evaluation. At 50, if the patient is found to have hearing loss, it is critical to start treatment early to avoid some of the devastating consequences of untreated hearing loss. Alternatively, if the patient has normal hearing, a baseline will be established and used for comparison at follow-up appointments. What if I don't believe in early treatment of age-related hearing loss? Unfortunately, for many patients it takes nearly 7 years for them to admit they have hearing loss, or to succumb to pressure from family members, and start treatment. By this time, the hearing loss will typically be at a moderate degree or beyond and, in some cases, treatment outcomes can be negatively impacted. To assure a positive prognosis and improved treatment outcomes, hearing loss, just like other health conditions, must be caught early and treated early to maintain a safe and healthy lifestyle. Catch it early and treat it early. What is sensorineural hearing loss? Sensorineural hearing loss, SNHL, is a hearing impairment that results from damage to, or dysfunction of, the inner ear, cochlea, and or the auditory nervous system. Age-related hearing loss is a form of sensorineural hearing loss. What is conductive hearing loss? Conductive hearing loss, CHL, is a hearing impairment that results from damage to, or dysfunction of, the outer ear, pinna and ear canal, and/or the middle ear, the eardrum or ossicles, hammer, anvil, and stirrup. In some cases of CHL, medical or surgical intervention can help restore hearing function. 94 Inspiration for hearing well. What is a processing disorder? Hearing loss is often defined in terms of the amount of lost volume that results from either a SNHL or a CHL. However, many patients, even those with normal hearing levels, can have a processing disorder that will limit their ability to understand and follow speech in background noise. The noise cancellation feature in the technology treatment plan provides significant benefit by reducing background noise and enhancing speech even for those whose testing indicates normal hearing. Should I bring a family member with me to my appointments? I answer this with a decisive yes. Your hearing loss not only impacts you but also everybody around you. I have always encouraged every patient to bring a spouse or a loved one to every appointment so he or she can help me, and the patient, better understand the daily impact of hearing loss on everybody's life. It is also important to assess how your family member speaks. Are they a soft talker or do they really mumble? It also helps me to know more about how you communicate with each other. What is a technology treatment plan? In recent years, traditional hearing aids, which simply make sounds louder, have been phased out and replaced with a technology treatment plan. These treatment plans are considered prescriptive in nature as determined by the FDA. The significant cognitive benefits to a technology treatment plan include binaural processing, two ears working together, sound orientation, ability to detect the source of incoming sounds with increased accuracy, enhanced clarity of voices, even soft speakers, automatic adaptation to environment, no more pushing buttons and adjusting volume, and noise cancellation filtering of background. Dr. Jill E. Copley, Au.D, CCC-A 95. Noise to enhance hearing conversation in noisy environments, hearing better in crowded rooms, restaurants, etc. What is the primary benefit of a technology treatment plan? This answer is outlined in greater detail throughout the book. In summary, recent reports find that a technology treatment plan and the treatment of hearing loss can significantly improve quality of life, reduce the risk of developing dementia, and offer an increase in cognitive function. Yes, all of this can be achieved by treating your hearing loss. How do I get started with a technology treatment plan? It's simple. Request an appointment with Total Hearing Care, or a local audiology clinic if you live outside of the Dallas-Plano area. Is getting traditional hearing aids still an effective treatment for hearing loss? For the majority of patients, traditional hearing aids will not effectively treat hearing loss or the symptoms of hearing loss, including tinnitus. Traditional hearing aids are volume-enhancing devices that may help certain people in very limited environments, e.g., conversing one-on-one in a room with no background noise. For patients needing to follow conversation in dynamic environments, e.g., sitting at a dinner table with family and friends, going out to a restaurant, sitting in a lecture hall or a place of worship, playing cards with others, etc., a technology treatment plan will restore clarity and enhance speech even in background noise. While the FDA has approved traditional hearing devices and OTC, over-the-counter, hearing aids for milder hearing loss, patients will not receive assistance in these dynamic environments. 96 Inspiration for hearing well. What are some of my payment options besides insurance? Ways that many patients pay for their technology treatment plan include paying by check or credit card, using insurance benefits, utilizing health savings accounts or flexible spending through their work insure. Aunt's plan, financing at 0% for 12 months at a fixed rate, or even taking advantage of the 4-year financing program offered by Total Hearing Care that includes additional benefits outlined in Chapter 4. What if I need an emergency appointment before or after office hours? This answer is a bit longer than most because of the seriousness of some audiology emergencies. Audiology emergencies most often fall into one of two categories. Sudden change in hearing. While rare, a sudden change in hearing can occur. This medical condition, known as sudden onset sensorineural hearing loss, may occur in one, or both, even more rare, ears and is often associated with a virus, and sometimes occurs in tandem with an upper respiratory infection. There is varying data on successful treatment protocols for this disorder. Regardless, the key to potentially recovering hearing function requires seeking medical attention within 24 to 48 hours of initial symptoms. If you suspect you have a sudden hearing loss, contact your audiologist, primary care physician, or ENT, ear, nose, and throat, for immediate assistance. Emergency related to the technology treatment plan. Broken or non-functioning devices may occur from time to time during your treatment. If there is any disturbance, such as lost domes, tight speaker wires, or irritation, call your hearing care provider's office. Dr. Jill E. Copley, Au.D, CCC-A 97. as soon as possible to have them evaluate the urgency of the problem and schedule you to be seen accordingly. In the interim, here are helpful hints to remedy some of the problems that you may encounter until you can be seen in the office. Itching is normal in the early stages of wearing devices. It is important to be sure your dome or ear mold is clean. A device causing feedback or squealing can generally be worn until you are seen by our team. Call the office as soon as you notice this feedback or squealing so that we can evaluate the reason or schedule you to make a prescription change. A dome, ear mold, or removable device that is not fitting well is not to be worn until it can be properly adjusted at the office. Call the office as soon as possible to have your specialists make the adjustment for comfort and fit. Domes stuck in ear. While disconcerting, getting a dome stuck in your ear is not a true emergency. If this occurs, stop wearing the hearing device. I often tell patients to not waste their time and money at urgent care or an emergency room. Call your audiology office during office hours to schedule a time for its removal. Domes are easily and quickly removed, and a patient can often be seen between scheduled appointments if needed. If you are experiencing an audiology emergency that can't wait for regular office hours, most audiology offices have a special number to call either before or after business hours. If you can wait until the office is open, most offices will have special emergency appointments set aside each day to help in these situations. 98 Inspiration for hearing well. Can my technology treatment get wet? Unlike traditional hearing aids that had no moisture resistance, most of today's technology treatment comes with an IP57 or above rating for dust and moisture resistance. In lay terms, the IP stands for International Protection Rating and the 5 indicates the unit is dust protected. Highest score is a 6 on this scale, and the 7 indicates the unit can be immersed in up to 1 meter of water, that is over 3 feet. With that said, we continue to direct patients to not swim or bathe with their technology treatment. Should I sleep with my technology treatment? It is recommended to not sleep with your technology treatment for 3 reasons. 1. Sleeping with the device on can cause discomfort to the ear and side of the head. Give your ears a rest. 2. It is easier for a device to fall out when you turn over in bed and may get lost. 3. Your batteries will wear out more quickly. If using disposable batteries, you will have to change them every couple of days. If your devices are rechargeable, you will have to remove them and recharge them during waking hours. Takes about 3 to 5 hours. How do I regularly clean my technology treatment? Like with cleaning your home, clean it a little each day and it won't become such a mess. Your audiologist will help you understand daily and monthly routines for maintaining your technology treatment at home. Use a lint-free cloth and brush, typically provided at your first treatment appointment, to wipe down the unit every day. This will help prevent oils from the skin, dandruff, earwax, and other environmental dust from clogging the microphones and speaker over time.